listening to the Pharmacy Podcast Network.
This continuing education podcast series on medication safety is made possible through a grant from Waypoint RX. Waypoint RX's sole purpose is to increase and protect the wealth of privately held business owners. Their focus on independent pharmacy owners reflects this purpose to empower pharmacy owners to find new ways to make money outside of the PBM model, protect their pharmacy from loss of employees, create financial independence outside of the pharmacy, and empower communities to reclaim the resources that have been stripped away by profit-first, people-last big businesses. For more information about Waypoint RX and their independent community pharmacy programs and solutions, visit waypointrxus.com. That's waypointrxus.com. Welcome to the PEERx to Peer Pharmacy Talk podcast, where we bring you the latest insights, expert discussions, and continuing education to enhance your pharmacy practice. I'm your host, Dixie Leikach, pharmacist. We invite pharmacy experts to discuss how ethics and pharmacy hot topics mesh. I am the president and CEO of Pharmacy Ethics, Education, and Resources, PEERx. At PEERx, our mission is straightforward, yet profoundly important: to educate healthcare professionals on ethics to improve patient safety. So whether you're a seasoned pharmacist looking to refresh your ethical knowledge or a new practitioner eager to build a solid ethical foundation, PEERx to Peer Pharmacy Talk is here for you. We will hear from the leaders in pharmacy, provide case studies, engage in thought-provoking discussions, and leave you with actionable solutions to elevate your professional practice. Together, let's make a positive impact on our profession and the patients we serve.
This is a special opportunity for us, and I'm excited about reintroducing this very special person to the pharmacy profession and how it's changing, how we know it's changing from prescription fee to value-based care. There's a lot more things that are going to come into that in being the clinical-driven pharmacist provider. Dixie Leikach, I am so excited to bring you back to the Pharmacy Podcast Network through a special promo that we're doing because of a special CE program that you're launching. And it's exciting that the Pharmacy Podcast, I get to talk to you about this. So Dixie, how are you?
I'm great. Thank you for having me again, Todd. This has been a lot of fun working with you over the last couple of years, and I'm excited to be back. Thank you for having me.
You opened my mind to a part of pharmacy care and the pharmacy profession. And like I said, we are moving from a transactional-based profession that's been that way for years, which was fine in and of itself because there was enough revenue to pay for pharmacy care and the intricacies of medication management and polypharmacy and addiction and so many things that are coming out of the profession, digging down into the clinical. And when you start talking about that, the rise of ethics in medicine, ethics in pharmacy care comes to mind. And you've put together a continuing education series, a 4-part series. There's 0.5 credits per episode, 30-minute episodes, 4 of them. So this 2-credit course is going to really talk about medication safety, but I can't wait for you to give the listeners the summary of it because it's the ethical principles of pharmacy care and how that relates to safety. So this is fascinating to me as I'm a fan, obviously, of our profession, our pharmacist, and I never thought about this. So take us away. Tell us about what this is.
Well, I guess I'll start from the beginning. I mean, we've explained a little bit in the past what I've done with a nonprofit organization that I founded in 2015, which is called PEERx, Pharmacy Ethics, Education, and Resources. And I wanted, I created this so that we'd be the resource for pharmacy ethics and continuing education. There's my mission. We want to educate, when I started this, I wanted to make it as broad as possible, educating all healthcare professionals on ethics to improve patient safety. And it's mainly, I started looking at, most pharmacists need continuing education. We're required, mandated to do continuing education on either medication, patient safety. I kind of look at, it's the same thing. And I started looking at that, like, well, how do I want to be different from the other people doing it? So I started looking into, well, medication safety, some of that's just the technical aspect of dispensing or preparing medications, but there are situations where it becomes an ethical issue. It can become, you might have to make some choices that you need to bring in your personal ethical decisions and personal ethical principles, but then also identifying what the ethical principles are that really govern pharmacy and pharmacist. And we have, one of the things I talk about in the CE that you mentioned that we're very excited about is the Pharmacist Code of Ethics that is in, it's housed at the APHA website. And actually, I was one of the podcasts, we specifically talk about Pharmacist Code of Ethics with Teresa Toll, who's a past president of the American Pharmacists Association. So that's one of the episodes. I also have my own personal one that I've done that is on improving patient safety through ethical decision making, like not just looking at patient safety as, like I said, that technical piece, but sometimes you have to make decisions and you might need to breach one ethical principle in order to honor another one. And we talk a little bit about that in theirs. And then I have one of the CE programs is with Donna Horn, and hers, we had a lot of fun talking about it. Medication errors aren't necessarily fun, but I think we try to make it fun, but they happen. And the focus of that program is it's the response that counts. It's not just what you do with the medication error, like fixing it or addressing it, but it's also how a pharmacist responds to that patient and how that makes a difference. And then the fourth one is with Dr. Tosin David, and we talk about how to prevent those adverse drug events and talking about culture of the workplace. Donna and I talk a little bit about that as well, like making sure your culture is comfortable enough that people are willing to talk about the med errors. We've all been in situations, I would imagine most pharmacists have been in situations where the culture of the workplace isn't necessarily open to discussing those med errors. So that's generally the four CEs that we have posted, and that's on the ConveyMed app. And I know it would also be available on the Pharmacy Podcast Network for our listeners to access. And so it's the Pharmacist Code of Ethics, improving patient safety through ethical decision making, medication errors happen, it's the response that counts, and preventing adverse drug events through a culture of well-being. So I really appreciate my friends, Teresa Toll, Donna Horn, and Tosin David collaborating with me on this project. We've all learned a lot. We've learned a lot about technology and how sometimes things can go wrong and things can go right. But what's fabulous is that these you can take these CEs separately, or you can do them all together. You can decide which ones interest you the most, or go ahead and get the full 2 hours. And they're available at no charge. So on the ConveyMed app, so you'll be able to get up to 2 CEs at hours at no charge to the listener, which is only possible through a grant from Waypoint RX, which are big supporters of PEER. They've been sponsors of ours for many years since I started this program in 2015, because it was important to the Coakley family that they're associated with ethical business practices and ethical pharmacy practice. And they've done a lot for independent community pharmacy and try to help us be stronger. I come from an independent pharmacy background. My husband and I, at one point, owned up to 5 independent pharmacies, and were able to retire from that industry about 1.5 years ago, but we were able to keep those last 3 pharmacies independent, which was very important to us. And some of the reason we were able to do that was because of Waypoint RX and the work we did with them over the years. And the Coakley family, as you can see on the screen, Matt and Ben are really incredible people to work with, and just appreciate their vision in recognizing that this podcast is going to be a great way to get the message out of what I'm trying to do with PEERx, and just at pharmacy ethics in general. I think there's a lot going on. There's a lot of pressure, especially in community pharmacy, no matter whether you're independent or chain, that, profit margins are down, workload is higher, workforce stress is an issue. And when you've got all these different things coming at you at one time, I'm just, over the years, that tends to be when ethics can sometimes decrease and fall by the wayside. So I'm out here trying to, stand on my soapbox and make sure we keep in mind that, our main loyalty is to our patient. We need to make sure we're doing everything we can to make sure they're safe and receiving the best care possible that is available from their pharmacist. So
that's great. I want to go back to some of the things that you were sharing with the listeners, and you really gave us an entire summary of not only the 4-part series that is great for CE, and hey, if it's 2 credits of CE and you don't have to pay for it, and it has something that is extremely valuable in today's modern society, and the pulling away of evidence-based medicine for popularity in some cases, rather than really taking the long road sometimes in order to come to true scientific decisions. And pharmacists understand this. I've heard pharmacists from all over the country come up with different discussions that we don't really dig into the ethics sometimes of what we're talking about. I love how you said that the technical, the pharmacological is not what we're talking about, because that in of itself is science. It's the decisions behind that are very specific to the patient in the individual care, which comes to a whole stance, and you could call this, I guess, an ethical decision of a pharmacist to say to their management teams, I need more time with my patient. You cannot sometimes shove our consults into these 5-minute and 10-minute and 20-minute windows, or sometimes never being able to consult with a patient because of the system crunching them so hard and putting so much pressure on them to put out a certain number of prescriptions to once again get things paid for in today's volatile, pharmacy care situation when it comes to payment. That in of itself, Dixie, is ethics and the ethics of medicine. And
having that confidence and
yes,
and knowing that, I think when you look at it, it's maybe even beyond confidence, but when you start to look at things from an ethical standpoint, you become, I think, more confident about being able and willing to speak up for those issues. And that's one of the things in the podcast with Teresa and I talk about, is that we have a responsibility to speak up. If something isn't safe, if we're in a situation that isn't safe, or we know there are things going on that shouldn't be going on, and there are instances where, yes, it was, there were decisions on a higher level to break the law, for lack of a better word, or not process things the way they were supposed to be processed. And the problem is everyone else went along with it.
Mm-hmm.
And so it wasn't just the owners that were held accountable, but all the pharmacists were held accountable in some way, because they didn't speak up. They didn't do anything about it. And when you start to look at that from an ethical standpoint, like, it's my ethical responsibility to protect my patients or make sure my patients are safe. And if there are business decisions being made or negligence going on around me, then I'm obligated ethically to do something about it.
But isn't that
changes it just changes the thought process a little bit.
Yeah, but Dixie, isn't that the absolute meaning of being a pharmacist, is keeping your patient safe? Like that, and with that comes the reputation that pharmacists are either the first or second most trusted professionals, from lawyers and doctors and, taxi cab drivers, and all of the surveys that have come out over the years. And maybe, or I shouldn't say maybe, because I'm just being trying to tell a story about it, when in essence I don't believe it. I believe that pharmacists are the most trusted for a very specific individual reason, and that is their science and their belief in what they know, because of being able to see it happen and see it take place and changing people's lives that they're helping through pharmacy care. And we could get even into disease state specific of outcomes, where it gets pharmacists excited that what they helped with the guidance of your physician, once it reaches your desk or your bowl and pestle, as a pharmacist, it's now your turn to make decisions based on your pharmacological, your understanding of the patient, your understanding of the surroundings of the patient, the things that are impacting that patient's care, the stigma that is surrounding the patient, that is preventing care from really taking place. Dixie, this is so important. This is and it's come at a good time, because our profession's ready for this. Because, like I said, we are moving away from a transactional pharmacist to patient experience. Not in all cases. You know as well as I do, there's maintenance meds that you don't have to necessarily see your patient for a certain specific time. But we also know, on the other hand, that in the big chain environments, when you're spinning hundreds, if not thousands, of prescriptions a day, how much time is the pharmacist getting with their patient to slow it down and find out what's really happening with this patient, rather than keeping them in the fast food? Because fast food pharmacy, to me, by definition of what you're saying in the ethics of pharmacy, is junk pharmacy, because it's not allowing the pharmacist to truly take an opportunity to engage the patient, find out what's really going on, maybe do a medication review. Maybe there's some danger in their lives. Maybe they're been sexually assaulted, or maybe they're depressed, or they're manic, or, they just had a baby and they don't know how to get rid of these feelings of, suffocating the baby because the baby won't stop crying. I mean, there are so many dominoes that could be pressed if we allow pharmacists to do what they're trained to do, and then understanding the ethics of it all. It's wonderful.
And what I find interesting is when we do expand pharmacists' scope of practice, and there's definitely a primary care crisis in the country, and it's only going to get worse. And pharmacists are positioned exactly where we need to be. We are the most accessible healthcare professional without a doubt. And we have the educational knowledge, we have the technical knowledge. We can take some of this burden off the primary care system and work with it rather than against each other. And however, just to what you've said, we need to look at what, for every win, that as an independent community pharmacist, I was like, okay, we get to now do this and this and this, and the payment models are improving. We've got organizations such as CPSN that's out there, working really hard for independent, or not even just independent, but community pharmacies to be able to provide these pharmacists clinical services and get paid for them, and get paid nicely for them through contracts. And even, the insurers are recognizing the value, what pharmacists can do to improve those health outcomes when they're engaged with the patient on a regular basis, because we've been doing it for free all this time. But once somebody actually starts paying us and they can track the data, they're able to see what that pharmacist can do. But then I've got my chain colleagues who are, like you said, so overwhelmed with the dispensing piece that their attitude is, we can't do one more thing. Like, how am I supposed to do the vaccines and the point of care testing and, HIV prescribing and contraceptive prescribing? Like, when am I supposed to fit all that in? And so a couple things I think are going on to make that more possible, because we're kind of in this really, I find it a tight position, because we haven't let go of that dispensing role. There's some pharmacists that are just going to hold on to that till the bitter end, but the clinical role hasn't met that. We haven't gotten to the point where that can replace the dispensing income. And as the dispensing income keeps getting lower and lower, it's hard to sometimes justify that time. But I think if we keep with it and keep working with other organizations to make this happen, we'll get there. But right now, I applaud the companies and the boards that we need to use our technicians better. Mm-hmm. We need to figure out a way to pay them what they're worth, while still, and that's difficult. As an independent owner, I would have loved to have paid my technicians much more than we did, but there wasn't the income to do it. Like, I still have to pay my pharmacist a market rate. So that's kind of where we are right now. And that makes it tough. But then also, the companies that have recognized they need to get rid of some of these metrics, that you need to fill this many scripts in this amount of time, or you need to do this many vaccines, or you're not going to see your bonus or raise. And those types of things are starting. Like, I understand the carrot and the stick concept. You need to have business goals so that you can meet your budget. But on the other hand, when it becomes more like I almost want to say a whip. It's, the horse and the whip instead of the carrot and the stick. That's when it becomes a problem. And we're seeing that with the workforce stress. And that's one of the things, I also have continuing education programming on the PEERx.org website, and that are available. And I try to pick topics that are the hot topics of now. During COVID, I created one just on how do we deal with something like this in the future when it happens again, because most likely it's going to happen again. And how do we work with workforce stress? How do we, give our attention to that, and maybe try to take care of ourselves differently so that we can take care of our patients, and even looking at that from an ethical standpoint. It's not just, self-care isn't just self-care. It's it can become an ethical issue. If you're not taking care of yourself, then you can't take care of your patients, and different topics like that. So that's another of what I try to do, is take these hot topics that are going on. I I see you at a lot of the national pharmacy meetings, American Pharmacists Association, National Community Pharmacists Association, and CPA. I know you're out there, you're talking to pharmacists, and we always see certain, every year there's certain topics that seem to be going over and over at each of these. So I try to take those and say, well, how can I look at this from that ethical lens versus just a surface type of situation? How do we talk about this a little deeper?
So another thing that I'm excited about is the fact that PEER is not just focused on pharmacists. And this made me very proud because we have 2.3 times or 2.5, I can't remember what the statistic is. We have about 2.5 techs for every pharmacist. So there's 305,000 active pharmacists. You times that by 2.5, and that's how many pharmacy technicians. Our technicians are friggin' rock stars, the right hands of our pharmacists. And we have to remember that their ethical decisions against massive organizations or small organizations or one-on-one or a hospital situation or whatever it is, the pharmacy technician, the professional, I'll change what I just said. So it's the professional pharmacy technician who knows that this is truly a career. This isn't a punch in, punch out job. There's ethics that come with that. So talk to us about this pharmacy technician training program.
So the right now we have a Maryland Board of Pharmacy approved pharmacy technician training program, and this kind of evolved over the years. I can't remember it was probably 15 years ago or so. Maryland mandated that our technicians needed to be registered with the State Board of Pharmacy. And part of that is recognizing that the role of the technician is growing and expanding and becoming more important. So there needs to be some sort of standard of educational background and making sure there's a core knowledge base of a technician in this role. Because, you don't always realize training's going to be different in different locations, right? So some technicians are trained better than others in the past. And so Maryland put this program in place. The technicians that had already been in that space for a certain amount of time were grandfathered in, but moving forward, if you wanted, obviously if somebody goes through one of the national certifications and passes the national test, then they can register with the Maryland State Board of Pharmacy. But as a pharmacy owner, I still wanted the ability to take that rockstar cashier, that clerk that comes in and they, you hire them and they just are, that you need to give them a better salary and how do you justify that and get them in a bigger role so that it becomes their profession and their career, not just a job as, working the register. So we created our own pharmacy technician training program and got that approved by the board. And I became very aware that a lot of pharmacies, including some small chains, were looking for this same kind of pathway so that, they wanted to train the technician in their space. And, they didn't necessarily want somebody who's been trained in a classroom and then trying to train them the way they work. So I created a program that would allow a pharmacist to, really tailor that training program to their site, but also keep to the standard of what the Maryland Board of Pharmacy wanted the technicians to be able to show they have the knowledge for. So it's a basic outline, and we use the American Pharmacists Association technician publications that they have available as a required library. And then there's two versions of the test to give them an opportunity, because they have to pass in Maryland, they have to pass a test with a certain percentage. And so this has become very popular in Maryland. I've gotten several organizations that are recommending it for their member pharmacies. We have Epic Pharmacies, Care Pharmacies, and the Independent Pharmacist Association of Maryland, IPMD. They all are supportive of this program and recommend it to their members. Now, this is Maryland, because that's where I am. So I moved it to the PEER program after a while, to the PEER umbrella, because I just wanted this to be available for any pharmacy that needed it. But then what's next, what I would like to do next, is figure out what other states have a similar program. Because I know some states don't require registration yet, some do, but don't have a test requirement, like a formal training. And there are other states out there that do, that maybe this program would be beneficial for them. So that's another kind of, once I get some other projects finished, that's my next thing that I want to work on, is identifying which states would benefit from this program, and then doing the research to figure out what I need to do to tweak what I have and make it applicable for other boards of pharmacy.
Dixie, before we wrap up, I want to share something with organizations that are listening. You may not be a pharmacist. You may not even be a pharmacy technician. You might be somebody in business with a wholesaler, or a one of the new up and coming PBMs like RX Preferred, which is one of our clients. But if you're listening, if you're an organization and you want to tap into what Dixie's doing, bring this to your employees, your pharmacists, your pharmacy technicians, your people that are working alongside those two very important people that are working together in all of our communities. But there's annual sponsorships available, and I want you to take a look at PEERx.org. Once again, that's PEER, PEER, and then rx.org, PEERrx.org. And reach out to Dixie. Your contact information is out there. Once again, I want to give a shout out to Waypoint. We're also working with Waypoint to create more content for our pharmacy owners that are looking for ways to level up. And part of that is the ethics of our profession, and returning to the way things were in a simpler time, where there wasn't so much pressure on our pharmacists and technicians based on the payment methods that are the status quo. But we're seeing changes happening. And I also want to give a shout out to our pharmacy state associations, like Pennsylvania State Pharmacists Association, the PPA. They're a great organization that believes in those kinds of things from an ethical perspective of what pharmacy care really means. I'm excited to be a little gong in the wind of how fast things move, Dixie, and we're going to be doing some social media push of your organization as well, and getting more pharmacists to realize that you're here. If you're a pharmacist and you're listening and you think that this ethics way of thinking as part of pharmacy care, bringing us back to the pharmacist oath that every pharmacist took, and what that oath really means is that there's an ethical positioning and a right that a pharmacist has to stand up for their patient's care. That care is pharmacological, obviously, but it's fighting for their payment that they need. It's fighting for their support model that's surrounding them, their family, and what kind of environment that they're in. Are they food secure? Are they water secure? Are they shelter secure? And there's a whole build out of what I want to bring you back and talk about ethics and the business of pharmacy's ethics. I'm going to have you back on This Week in Pharmacy, Dixie, and we're going to talk about that.
I appreciate it. I just want to mention, like with the sponsorships, individuals can give to support PEER. And anybody that gives to PEER, it allows me, CE has a cost associated to it.
Yeah.
So the more sponsorship I can get, then the more content I can get out there. I'm looking for companies like Waypoint that want to sponsor future podcast episodes. I'm looking for organizations that want to provide discounted or free CE programming for their members or employees, whatever that company looks like. If it's a Maryland company, at this point, they get discounts on the technician training program. And there's just, there's lots of opportunities. I am available for speaking for organizations. So that's another way to support PEER and our mission, what we're trying to do. So just, sometimes it's just the goodness of an organization or a business's heart, like Waypoint and RX Audinetics, which works a little bit more with the business side of pharmacy, but they felt like it was important to support what I was trying to do and be associated, be known as somebody that pharmacy ethics is important to them. So, but it's everywhere from an individual to a large organization. You can give as little as $25 to $25,000 if you want, but right. I appreciate the support I've received over the years. It's allowed us to continue to do the work that we're trying to do. So, I'd love to be able to do more podcasts in the future and provide those CEs at no charge. So that's kind of really my focus right now, but there are other opportunities for lower sponsorships as well. So I appreciate you mentioning that because it does make a big difference.
Absolutely. We'll be sharing your information on LinkedIn, on Instagram, on Twitter, and Facebook. And if you want to get a hold of Dixie, once again, go to PEERx.org. Dixie, can't wait to have you back. Want to dig into more specific sectors of pharmacy and where ethics plays a part. I want to talk about specialty rare disease. I want to talk about a health system, hospital system, our seniors, which, by the way, are rising. In 2024, more seniors are hitting that. More people are hitting that magic age of 65 years old than ever. And so there's ethics in that. So we can't wait to have you back.
We have lots to talk about, Todd. I appreciate you having me and your support. It's been very helpful getting the message out. So thank you so much.
Thank you. And hey, listeners, thank you so much for listening. Please rate us, subscribe on Apple Podcasts or Spotify. Give us a rating. Mention PEER, mention Dixie. If you're interested in learning more about PEER, please, once again, PEERx.org. And we'll talk with you next time.
Additional programming is available on the PEERx website, which is PEERx.org. Again, PEERx.org.